Access to free healthcare for COVID-19 is coming to an end, marking another milestone in pandemic recovery.
The federal government's public health emergency end date is just 2 weeks out. Tahlil Mohideen joins us to share what that'll mean for Wisconsinites.
Well, it won't happen all at once, but a lot of the state's pandemic programs are coming to an end. So leaders from the state's Department of Health today suggest taking advantage while you still can. After months of all COVID all the time,
I would say we're thinking about it a lot less.
there appears to be an end of sorts in sight.
We can't just say, oh, it's gone, it's no longer around. It is around, and we have to be responsible.
Come May 11th, the federal government's public health emergency will no longer be in effect, taking with it many of the state's pandemic programs.
The fact of the matter is that the public health emergency was a trigger for federal and state funding.
In the coming months, as existing federal supplies run out, most services related to vaccines and testing will again require insurance or personal payment.
I get it. You have to at some point.
But even as COVID cases, hospitalizations, and deaths have decreased significantly in Wisconsin since pandemic peak, there's still some concern. The theme: we've been here before.
Seems like every time we've thought we're out of the woods, we're not out of the woods. I'm not sure what my criteria is going to be to stop wearing a mask and stop being concerned, but I'm guessing I'll know it when I see it.
It's actually that kind of caution health officials want you to consider, because regardless of scale, COVID is going to stay a part of our lives.
I do keep sanitizer, so we're still, kind of up with the sanitizer after using the carts and things like that. But as far as the mask and things, nope, kind of eliminated those.
And even as the public health emergency winds down, officials say there's still a lot we don't know about the disease and its effects. But the message to get vaccinated and stay current with the doses remains the same. DHS expects at-home testing will likely be more costly regardless of insurance status, as the state's direct-to-household program is set to end in May. COVID-19 vaccines will still be available for free until the federally purchased supply is depleted. State-run COVID telehealth will remain through December.